Hi, I'm Keith Murdoch with Trinity Health System.
And I'm Shelby Zarotny. October is Breast Cancer Awareness Month, and breast cancer is the second most common type of cancer in women. In fact, 1 in 8 women born in the United States will be diagnosed with breast cancer at some point in her life.
Fortunately, breast cancer is becoming much more treatable due to the advanced research that's taking place. You'll get to know our physicians personally, and they will educate you on the importance of early detection and treatment of breast cancer. You'll also hear from a breast cancer survivor, and she'll tell her story about how she trusted the Trinity doctors with her breast cancer treatment.
Well, when a patient first hears the words breast cancer, you have breast cancer, they're scared. They don't know where to turn to. They don't know where to go. They need someone to help them get to where they need to go next.
Here at Trinity Health System, we put together a multidisciplinary approach. We come together collectively as a group and we discuss every patient and decide what the best course of action is. And the quicker we get that patient taken care of, the quicker we can get them back on their feet, back to a normal life again.
Everybody has to have one goal in mind, to care for the patient and to catch them, care for them, and see them survive and have a quality of life.
From the world-class medical oncologist to the radiation oncologist to the pathologist to the radiologist, we have a very comprehensive breast care team.
I think care at multiple facilities adds a little stress to the patient. Our goal is to make sure that we have it all at our facility.
We have the whole package here at Trinity, and that's diagnosis, treatment, whether that be surgery, chemotherapy, radiation. And it's great for women to have that ability to do same-day reconstruction if that's within their scope or need. That's all housed here, and it's all state-of-the-art here.
I'm aware of the emotional scars that can come with the diagnosis of breast cancer. And by just understanding that, it's easier to tell the patient that it's going to be okay.
I try and put myself in their shoes. You know, if I was diagnosed with that, how would I feel?
Well, the great thing about Trinity is we have a nurse navigator.
She is there to be able to tell the patient what the next step is.
I follow the patient. I go to surgery with them. I'm there when they have the localization. I usually speak to them in recovery. You know, you get to know those patients. You know their family history, their grandchildren. It's a very personal thing.
Well, our goals are to make sure that we have women getting their mammogram screenings in a timely fashion.
Screening mammograms can actually detect lesions before they turn into cancer. So I think that we've come to the point where, in some patients, we're actually preventing cancer, which I think is amazing.
So it's very important that you get a screening mammogram. A lot of people say they're afraid or they're embarrassed. That's not a good excuse. You need to get a screening mammogram so that you can carry on your life, you can take care of the people that depend on you, and if they should happen to find cancer, that's when you want to find it, in the early stages.
Trinity Health System has the most comprehensive breast cancer team in the area, and we strive to have the most up-to-date equipment and keep up to date with the current procedures.
However, what makes our care stand out from others is our doctors. Without the compassionate care our doctors provide, everything else is useless.
I'm Alexis Smith-Dio, the Director of Breast Imaging at Images Mammography Center, part of Trinity Health System. I had quite a few people in my family who had illnesses, cancer as a child. Both my godparents passed away, one from ovarian cancer and then another from heart problems. And through those situations, I met a lot of physicians and I realized what an impact they had on people's lives and how they could help people live better quality of life through the years that they have on this earth. I feel like I make a difference in patients' lives by intervening in them and by early detection of breast cancer. So I step into their lives, I help to save it to a degree, and then I also get to walk along with them through that journey. My patients, they know my name. They call me regularly. They stop in to see me, and I really enjoy that. I really enjoy that aspect where I get to see the patients and I also get to read their images.
My name is Denise Gilman, and I'm a surgeon at Trinity Medical Center. I wanted to be a doctor ever since I was a kid, honestly. The first time I remember was when I fell off my bike and I went to the emergency room and got stitches, and I was amazed. And that's kind of the point that I remember wanting to be a physician. When I went to medical school, I tried all the different specialties and tried to keep an open mind, but I always found that being in the operating room and doing surgery was the most interesting to me. To be able to cure someone's disease right away and be able to fix their pain or fix their problem immediately was very satisfying for me. I did a one-year fellowship in breast surgery specifically. During that year, I spent several months with all of the specialties that deal with breast cancer, from a medical oncologist to a radiation oncologist to a radiologist, and I think that that is something that I can offer a patient that they wouldn't necessarily get at another facility.
My name is Roseanne Piper. I'm a registered nurse and the breast patient navigator at Trinity Health System Images. My father was diagnosed with lung cancer when I was in high school, my last year in high school, and he ended up having radiation here at Trinity. So I saw how he was treated and I liked the treatment he got. He was pleased with the treatment, so that's how I kind of got interested in nursing. The breast patient navigator actually takes the patient's hand, or you explain everything to them, like what their cancer diagnosis is, what it means to them. They don't know where to go. They don't know what to do. They're so blindsided by a cancer diagnosis. It's basically devastating to them. So I'm there to take their hand and walk them through, and that's what we do. And they appreciate that so much. I think my most rewarding part of my job is when someone calls me and says thank you for being there, or you see them in the mall and they tell you thank you or give you a hug. That means so much to me. That means I've made a difference in their life. And it's a simple thing, it's a thank you. I couldn't ask for anything more.
I'm Dr. Craig Ozer. I'm the plastic and reconstructive surgeon here at Trinity Health System. I really always enjoyed working with my hands, and when I decided to make the decision to go back to medical school, it was pretty clear cut that I wanted to do something in the surgical field, and plastic surgery just seemed like the perfect field for me. And I find it very rewarding that you could take someone with a particular problem, and I like the immediate results you can see, as opposed to giving someone a pill, come back in a month, let me see if it adjusted your blood pressure. Surgery affords me that opportunity of seeing my results a lot quicker. It's always rewarding when you have a woman that was recently diagnosed with breast cancer. She comes into you most likely at like her lowest point, and you could kind of hold her, walk her through the process. But when you walk a patient from beginning to end, you hold their hand, you say, everything will be fine, I promise you. You know, I think that also is very rewarding too. You know, a lot of doctors will say to me, are you nuts giving your cell phone number out to all your patients? I said, for the most part, patients really do not abuse it. I just think it's an added little touch that most patients do appreciate. And I try and put myself in their shoes. You know, if I was diagnosed with that, how would I feel? And I realize, you know, when you get that diagnosis, you have 100 things running through your head. And maybe when they're in front of the doctor, they can't think of every question that they want to ask. So I think that it's important just that your patients know you're there from every step of the way. And that's one thing that I like to do for my patients.
My name is Samuel Licata. I'm a general surgeon at Trinity West Medical Center. Well, my father was a general surgeon, and I had the opportunity as a child to go watch him perform surgery, and was very interested in medicine early on in my life. In medicine, there are a lot of chronic illnesses that you sort of just continue to treat and they never actually get better. With surgery, you see a problem, you're able to operate on that issue and actually fix the patient. One of the things I'd like my patients to know about me is that I'm very in tune with what is going on in their lives. I feel that I'm very compassionate and understanding of what they're going through. I often tell my patients, this is what I do for a living, take care of breast cancer patients. However, this is the first time that they've gone through it. So I take that into consideration, that they have no idea of what they're in for, and if I can make that much more comfortable for them and give them the understanding of what they are going to be going through, then I think that helps a lot. Especially with our cancer patients, you see them 5, 10, 15 years out from surgery and they're a survivor, and they're very grateful, and it's very rewarding.
Trinity's physicians represent a professional and experienced background, and their compassion is second to none. The care we offer is not about us, it's about you.
When we return, you'll hear the story of a breast cancer survivor who experienced this type of care firsthand.
When I started getting leg pain from a herniated disc so bad I could barely walk, I wondered how I would ever enjoy time with my loved ones. Fortunately, the specialists at Trinity's Orthopedic and Spine Institute were there for me. Thanks to Dr. Fai's compassionate care and minimally invasive surgical procedure, I was out of the hospital the same day with only a small 1-inch incision. Now, I can get back to paying attention to the smaller things in life.
Take your business to new heights with the Tri-State's leading media team.
As my mother's primary caregiver, I have aided her through many health challenges. But when she started developing severe bed sores, my care for her suddenly hit a wall. Fortunately, we discovered Trinity Center for Advanced Wound Healing. Driven by a sincere passion for serving their patients, the doctors at Trinity helped nurse my mother to a full recovery. Nowadays, my mom is back to being her happy, healthy self and treating me like the kid I really am.
National Breast Cancer Awareness Month highlights the importance of early detection of breast cancer. Getting regular mammograms can save your life. Most women should start getting a yearly mammogram at age 40. If you have a family history of breast cancer, you may need to start earlier. Call Images Mammography Center today to schedule your appointment. This October, know your body and the importance of early detection.
Trinity Health System is proud to announce the most comprehensive surgical team in the Ohio Valley. With all of our world-class surgeons under one roof, Trinity is able to minimize your surgery and recovery time. TPG Advanced Surgical Associates, joining together to better serve the surgical needs in the Upper Ohio Valley.
With the number of diagnosed breast cancer patients growing every year, cancer could strike you or a loved one when you're not ready for it.
Like Tammy Smedley. Tammy's life took a turn when she was diagnosed with breast cancer. She trusted Trinity Health System's comprehensive care to get her healthy again. Here's Tammy's story.
Honestly, I was never good with self-exams. In 2012, I found a lump in my breast. Late summer, I lost my husband. December of 2012, after losing weight from losing my husband, I decided that this lump needed more attention. I immediately called Trinity, where I'd gone prior at Trinity Health Systems, and was able to get an appointment and have it addressed right away. We went, got an examined mammogram. It was breast cancer. You're never prepared. My first thought was my children. You know, where am I going to see them married? Am I going to see them graduate? I was now a single parent, so that was a lot on my plate that it's on me to take care of them. I was scheduled to have an appointment with Dr. Licata, a consultation, so I was able to meet with him in his office prior to surgery. He came into the pre-op and spoke with me before doing the surgery. I had dyed my hair pink. I will never forget him laughing with me. You know, I was very concerned going into surgery, and those few moments of putting me at ease, checking on me before he did the surgery, it was wonderful. After my surgery, they had given me I use the word consultation, at Terramana Cancer Center. They were very educational, explained the medications, explained the after effects, gave me phone numbers to call. I was amazed that it wasn't just, this is going to happen to you and you're on your own to figure it out. Trinity was amazing with that. It was like, we're going to handle this. It wasn't a death sentence to me. I'm now almost 2 years in remission. I have issues, I'll have issues the rest of my life, but I can handle it. As a woman, we're all busy. You can't be there for others unless you're there helping yourself. That's why it's very important to do the breast examinations and keep up with your appointments. I'm Tammy Smedley. I'm a survivor of breast cancer. I am vastly different than I used to be.
Tammy's life changed when she discovered a lump in her breast, but through Trinity's comprehensive cancer program, she went from a worried patient to a healthy survivor.
When we come back, we'll discuss how the stages of preventing and treating the disease can mean all the difference between life and death.
I've been cutting the same folks' hair for 30 years now. When diabetes sores developed on my feet that just wouldn't heal, I owed it to my clients to get the care I needed. Thankfully, the specialists at Trinity Center for Advanced Wound Healing were there for me. Because of the doctor's dedication to my well-being, I don't have to worry about diabetes affecting my work. Who knows? I might just get to do this for another 15 years.
I'm Dr. Denise Gilman, and I'm a general and fellowship-trained breast surgeon at Trinity Health System. I'm the region's only fellowship-trained breast surgeon, and I can understand all aspects of the patient's care that they're going through when they have breast cancer, from the initial diagnosis through the mammogram, from the biopsy to the surgery, which I perform. In addition, I can understand and I have experience with the medical oncology as well as the radiation oncology aspect of care. This October, know your body and the importance of early detection.
Take your business to new heights with the Tri-State's leading media team.
Thanks to technology advances and our growing knowledge of the disease, breast cancer survivors are becoming much more common.
Trinity's doctors are going to talk about the importance of early detection, receiving a diagnosis, treating the breast cancer, and the option of reconstruction.
Breast cancer really can't be felt. There's no pain that's usually associated with it. So a woman doesn't know that she has breast cancer until a cancer is very, very large.
I don't think anybody knows your own body as well as you do. And any little changes, any small differences that you feel may be something that you need to bring to your doctor's attention.
Self-breast exams should be performed at an early age, even in the teenage years, so that the woman does learn the nuances of her own breast.
So it's very important to start, as soon as you reach puberty, as soon as you actually have breasts, to start doing exams on them every month.
I think it's very important for Trinity to educate the patients to early detection through mammogram screening, because early detection is directly related to increase in survival for breast cancer patients.
The key to screening is that when we bring them in every year, we catch a cancer when it's a centimeter or less in size. It's much smaller than it would be. All of these things make survival much more likely.
The general recommendation is to start screening mammograms at age 40, one every other year, and then every year at age 50. Now there's a caveat to that patients that have had a strong family history of breast cancer, or that have had family members that have had breast cancer at a very young age, they should have screening earlier than that.
Well, our goals are to make sure that we have women getting their mammogram screenings in a timely fashion with early detection, making sure that they get their cancer treatment. Our goal is to have as many survivors as we can.
Screening mammograms can actually detect lesions before they turn into cancer. So I think that we've come to the point where, in some patients, we're actually preventing cancer, which I think is amazing.
So it's very important that you get a screening mammogram. A lot of people say they're afraid or they're embarrassed. That's not a good excuse. You need to get a screening mammogram so that you can carry on your life, you can take care of the people that depend on you, and if they should happen to find cancer, that's when you want to find it, in the early stages. Whenever a woman gets a diagnosis of breast cancer, it not only affects her, it affects her whole family. So when they hear breast cancer, they're worried about, not only about themselves, but who's going to care for their mom, who's going to care for their dad, who's going to watch the grandchildren.
When a patient receives a diagnosis of cancer, I really try to reassure them that it will be okay. We are very confident in what we perform at Trinity as high-level care. And I think that me being able to tell them that it's not as bad as what they think it's going to be will help out. These things are going to happen, but they will get through it and they will survive.
Well, the great thing about Trinity is we have a nurse navigator.
She is there to be able to tell the patient what the next step is.
The breast patient navigator actually takes the patient's hand. You explain everything to them, like what their cancer diagnosis is, what it means to them. We reinforce what the radiologist tells them, and a lot of times when they get a diagnosis, they don't hear everything. They don't understand everything, so that's what I'm there for. They're so blindsided by a cancer diagnosis. So I'm there to take their hand and walk them through.
It really is an all-inclusive system where we really try to help the patients along their journey through this, because it is kind of a journey from the time that they come into me and are seen to when they are diagnosed and I give them the news, and then they move on to treatment. I try to tell them to take it one step at a time. Breast cancer is one of those diagnoses that we have a lot of treatments for, we have a lot of research on. We can intervene and we can save your life and you can move on with your life.
Some of the fear is just what the treatment is going to be. Do I have to lose my breast? Am I going to lose my hair? Me being able to tell them that it's not as bad as what they think it's going to be will help out. These things are going to happen, but they will get through it and they will survive.
We have breast surgeons right here, we have the radiation oncologist, the oncologist, all in one place, and it's right down the street from where I've diagnosed them. And the doctors at Tony Terramana take all of the knowledge and education that they have from both UPMC and Allegheny Medical Centers, and they use that to tailor the treatment to the patient. So these are cutting edge treatments, some of the best in the world. And so we have access to those things that other community hospitals just don't.
There are 3 mainstays of treatment for breast cancer: surgery, radiation, and chemotherapy. Fortunately, we're finding breast cancers earlier because of screening, and they are curable with surgery. So surgery often is the first step. When someone is diagnosed with an early stage breast cancer, there are different options for surgery. There is either a lumpectomy or a mastectomy. And the option to do one over the other sometimes is patient choice. Sometimes it's a clinical decision whether they're a candidate for a lumpectomy or not.
We will always do our best we can to get the patient in and dealt with as quickly as possible, because we realize that the majority of the patients out there, once they get that diagnosis, they just want to know, when am I going to have my surgery to get this out? So we realize the sensitivity of getting that terrible, terrible news.
I feel like I make a lot of difference in the lives of my patients by being able to get them through their breast cancer. It's gratifying to see them 5, 10, 15 years out from their surgery as a survivor. They're very thankful and appreciative, and it's very satisfying to me.
When a woman loses her breast, it is very traumatic. And that's the nice thing about the reconstruction, is that they don't really have to ever see that. It's great for women to have that ability to do same-day reconstruction, if that's within their scope or need. That's all housed here, and it's all state-of-the-art here.
Not every woman is going to want to have reconstruction. Those women that do want to have reconstruction, when they come to see me, I tell them, listen, I will be there for you at the time of your mastectomy, and we will then decide which options are most appropriate for your treatment. And I think there's a couple advantages of having someone there at the time of your initial surgery. One is, if we are going to reconstruct the breast, when the woman first wakes up after that initial surgery and I'm able to reconstruct the breast, whether I'm using her own tissue or if I'm using an expander, I think there's a psychological benefit to waking up and there's already a breast mound there, as opposed to waking up and seeing nothing there at all. So I do feel that there's a huge advantage to doing it at the same time as your initial mastectomy.
And not that that's done all the time, or that patients need reconstruction all the time, or that they choose it, but at least that's an option to them. The more options you give people, the more that they feel like they're involved in, making the decisions about their treatment. And that's what people want nowadays. Patients come to you and they want your expertise, but they also want to be involved in their care.
Hi, I'm Dr. Craig Ozer, a plastic and reconstructive surgeon here at Trinity Health System. So the advantage of having a plastic surgeon here is that at the same time as your mastectomy, I could come in and reconstruct the breast so that when you wake up, you never have to see yourself completely flat. You'll wake up and you'll have a breast mount. In some cases, we can even reconstruct the whole breast at one stage. This October, know your body and the importance of early detection.
Take your business to new heights with the Tri-State's leading media team.
Hi, my name's Dr. Samuel Licata. I'm a general surgeon at Trinity Health Systems. I specialize in breast practice as well. I've been practicing breast surgery for the last 20 years at Trinity Health Systems. I am ranked nationally in the top 10 percentile of breast cases performed each year by breast surgeons, and this is based on the American Society of Breast Surgeons data. This October, know your body and the importance of early detection.
As a yoga instructor, stretching is an essential part of my life. But when a wound on my foot wouldn't heal, I was overstretching my physical limits. Thankfully, the specialists at Trinity Center for Advanced Wound Healing supplied the care I needed. They provided a comfortable recovery, giving me the confidence I needed to continue my passion for yoga. Now, I'm back to helping my students relax, both mentally and physically.
Hearing the words "you have breast cancer" may be the most difficult news a woman can have in her lifetime. Knowledge and proactivity are your best friends when it comes to preventing breast cancer.
Regular self-exams are crucial in an early detection of the disease. Mammograms should be screened every other year at 40, every year at the age of 50, and if your family has a history of breast cancer, well, screening should begin even before 40.
Trinity Health System is dedicated to your health, and that is why we feature a breast cancer support group for anyone who has been diagnosed with breast cancer. Trinity offers this support group the first Tuesday of every month from 5:30 to 7 p.m. For additional information, visit us online at trinityhealth.com.
Remember, no one knows your body better than you do. Know your body and the importance of early detection.